You're live.
Hi guys, it's Danielle. It's towards the end of the day, Fractora Friday, I guess, because I've been doing Fractora all day long. So Fractora and Morpheus has been back to back, and what we're getting from is a lot of skin tightening, general resurfacing, smoothing and tightening, and all around a more refreshed and youthful appearance. So our patient is definitely religious about skincare, and it shows. Her skin is nice and smooth and tight. So I'll just show you guys right here. Beautiful jawline, smooth skin. She's a little bit pink, and some of it is that her skin is naturally pink.
She's very sensitive.
Very sensitive.
The wind blows and I'm sensitive.
The wind blows and she turns pink. But a little bit of this is also from the numbing cream, and so we have had a little bit of numbing, but you can see here, just mild redness starting to develop. I'm gonna turn you a tiny little bit. I've already treated the forehead, so you can see right here color differentiation between the untreated area and what has already started to develop some erythema. So very mild reaction, even in someone who has sensitive skin. I'm gonna keep going. So we do this treatment every couple of months to keep her skin tight and keep her pores small. And even though it can be a little bit uncomfortable, it does such a good job at tightening and lifting. It's perfect for softening around the mouth and the nasolabial, so people are always coming back for it. How quickly did you heal last time? What was your downtime?
Usually for me, it is about, and sorry, I'm numb right here, so I'm just crazy when I'm talking. Usually 7 to 10 days for me.
Okay, so that to me, 7 to 10 days is like you're back to being like flawless, right?
Correct.
Because to me, I want patients to know that downtime is manageable. Like you can go back to work. You're
Absolutely.
gonna be a little bit sandy, you'll be a sandy feeling, and you'll be a little bit red. You're not gonna look your best, but it's not something where you need to hide out. Is definitely key, I think, with this treatment. And so we are using this to work all the way around the mouth. These are coated needles, and so what that means is that we're able to get some skin tightening in a lot of different skin types and minimize the risk of hyperpigmentation.
And how do you clean the tips for each patient?
Let me give you a second to breathe.
Thank you.
So they are sterile tips, they come clean. You can see here that there are 24 little needles there, and that's what's delivering the energy. These coupling prongs become flat with the skin, and the energy comes down and around, and it really disperses well into the deep dermis, so you do get a lot of tightening. Look at the texture on her skin right now. It's a little bit bumpy. She's got that pinpoint swelling around all the tiny little needle marks. So you can see that there, some of them are becoming a little bit wider. This is a perfect clinical response. What you want is that redness, that tiny little bit of swelling. It's your skin reacting to the energy and reacting to the heat, showing that it's taking the effects and going to begin that cell turnover process. So we love to see that. Turn a little bit more. So I'm gonna finish up around the mouth here. This is an area where you really start to see laxity. Deep breaths. And so the needling here is great for the lines, great for under the eye. Couple more.
How many sessions has this patient gone through?
3?
Gosh, we did it probably every 6 weeks for a good year.
Really?
Yeah,
Oh my
we did it
goodness.
very often.
We've done a few of them without a doubt, but we also do other treatments as well. So we rotate between
Absolutely.
Clear Brilliant, Morpheus, Fractora,
Microneedling.
Microneedling.
I'm very religious
Dermal.
and anal about my skincare. So.
Turn all the way to the side. You know, she's a perfect patient in the sense that we incorporate different treatments because each treatment is giving you a different type of benefit, and they're all treating different areas. So when we talk about radiofrequency, which this is, what are the different types of radiofrequency that are out there, and you know, when is each one applicable for each patient? So there are needling treatments that are RF. There is something like thermage, which we've also done, and that's a non-needling radiofrequency that's great for skin tightening. And all of these different treatments fit into our treatment protocols when you want to be preventing the age or slowing the aging process, because there is no preventing it. incorporating these different treatments at different frequencies, whether it's every quarter or once a year, you're getting different layers of improvement. So this is the deep RF treatment. Thermage is a little bit more superficial of an RF treatment. And we can do things like True Sculpt or Venus, all of these other treatments to maintain.
So what would you recommend for skin tightening on the eyelids? Would you recommend Fractora or a different treatment?
Ooh, so I love talking about the eyelids because I feel like they get neglected and we don't want to do that. You are always looking at people's eyes when you speak to them. So it's important that you keep them youthful and looking great. So what can you do for the eyes when it comes, and I'll just demonstrate, but when it comes to treating the eyes, look at how much of the lid is on bone. So what I like to do is lift this up, and then I can actually treat right over this area. As long as you are on bone, you can use Fractora or any needling RF over that bony portion of the brow. That being said, you don't want to do anything that's going directly over the eye. I'll give you a second to breathe. Take deep breaths. The alternative that's great for around the eye is Thermage eye. So there's an actual Thermage tip, has this tiny little square, and you put a map on the skin, a grid, and you follow that whole area. You have eye protection inside the eyelid, and you can actually treat directly over the whole upper and lower lid. So that is a great one. That's definitely something that I want to be doing, twice a year for anti-aging and have my patients doing.
We need to do that.
Yeah, we need to do that. It's such a good one, and Thermage is great because it doesn't have downtime. So, depending on what she has going on in her life and what her schedule is like, the agenda, we can pick and choose our different types of anti-aging treatments, things that do or don't break the skin or have downtime or don't.
So I realize with this one, I'm going to have some. I'm going to have a little bit of downtime.
And we know which ones we choose.
Absolutely.
Go ahead and turn it all the way to the other side. So you can see she's red, getting a little bit swollen. The heat and the redness will come down when we do our aftercare protocol, but it usually lasts about a day. And I also, which is phenomenal, is I can just go ahead and start treating along her jawline, and this right here. We love it. So for the jawline, you lift up and just treat the area.
So do you do numbing or blocks before you do this treatment?
We can do all of it. We definitely do topical numbing. Deep breaths. We can inject numbing as well, which I had done on her forehead because it is a more sensitive area since it's very bony. She's perfect. She knows all the information. She'll recite this whole thing for me. Bye guys, signing off. Holly the Diamond.
Yes.
So, we can actually be using this all over, and we start to treat the neck. Go ahead and position back to the center. And this is great for this tightening underneath here because it definitely starts to build up a little bit of fat and a little bit of laxity. And the more that you maintain with your RF, the less you're going to see it set in. You okay?
Mm-hmm.
Chin down a tiny little bit. All right, guys. Are there any other questions about radiofrequency, RF, microneedling, anything at all?
How many sessions do you need of this to see an improvement?
Honestly, it varies. Thank you. She's going to answer all the questions for us. So I love this treatment because I think that you do see an improvement even with just one. You saw a change after your first one.
Absolutely.
It's a little uncomfortable, but she's like, I love it. Definitely makes it tighter. It's worth it. I always say that. Typically, if someone's coming in and they're really looking to tighten their skin, target those lines and wrinkles, or scarring to make it better, you're going to be doing a minimum of 3. For pretty much all laser sprays, the minimum, a lot of times a great result is between 4 and 6. And then you want to continue. You want to maintain and you want to keep on improving upon what you're doing. You can't stop the clock. And so with that, when you incorporate a little bit of maintenance therapy, your efforts go a long way. So results depends how many you do it, what you're starting with, and what else you're incorporating. One more, and then you'll take a second.
Would you recommend Cosmetic following a Fractora?
You can put Cosmetic, we've done it. You can put Cosmetic on top of Fractora. I tend to cool the skin a little bit, take some of the heat out before I put the mask on. But what the reason that's such a great treatment is because you are putting channels in the skin that allow the peel to really penetrate well. And so it is a good treatment to do. For some patients, we're doing Cosmetic beforehand because it's our safety net to try to prevent any kind of post-inflammatory hyperpigmentation. Last little row and then we're done. We'll just look at the skin.
Is there a difference between thermage and oil therapy?
Breathe. Between thermage and oil therapy, yeah, she's nodding her head. So oil therapy is ultrasound, focuses on the muscle, so actually great to combine with thermage. And the reason is because this area here, our whole face, our whole structure is muscle on top of bone. And so this especially tends to fall down. The muscles are weakening over time. Same thing around here. So when you incorporate oil therapy, you're keeping these muscles tight and in position. And then when you bring thermage in, you're keeping the skin tight and in position. So overall, what we want to do to prevent the appearance of an aging face is maintain the structure of the skin and the structure of the muscle. And using things like filler, we can do both to highlight and accentuate that, as well as replacing any changes in the bone volume that eventually gets resorbed and minimizes over time. So there's a little bit that you can do for everything. That's why it's so important to come in and do a comprehensive evaluation. But this right here was our Fractora treatment, and you can see she's got those little bumps. She's red, it's nice and even, and we're all done. She made it.
Do I need any around here?
We'll go back and spot treat for some of the tightening, but absolutely.
Just have some scars here.
Yeah.
It's great for scars.
It is good for scars. All right, guys, so I'm going to finish up our last little bit, but thanks for watching. If you have any questions, let us know. Bye.